Thank you. Agenda 1, welcome and apologies. So first of all, welcome to everyone. Sharon, are there any apologies?
Yes, we've got apologies from Councillor Eggleston, Councillor Havergees and Councillor Mackenzie Boyle, and Councillor Cochrane is attending as Councillor Havergees substitute, and Councillor Harrison is attending as Councillor Mackenzie Boyle substitute.
Thank you. Agenda item 2. Minutes of the previous meeting. Are there any comments on the meeting of the minutes? Are there any comments on the minutes from the 14th of May 2026? Okay.
I've just been asked to raise this. There was, actually, our recollection was that the inquiry into the planning portal thing was going to be done by this committee. I think there's been a clarification on that it's actually going to a scrutiny panel first.
Yes, so the Environment and Communities panel will do the work, and then they will present their findings back to this panel, this commission, and we can have a debate at that point. If there are no amendments, I move the minutes to be accepted and request a seconder. Thank you, Robert. The minutes have been accepted. Agenda item 3, declarations of interest and party whip. Does anyone wish to declare an interest or note they are working under the party whip? No. Thank you. Agenda item 4, urgent item of business. Sharon, are there any urgent items of business?
There are no urgent items of business, Chair.
Thank you. Agenda item 5, public participation. Have we received any requests under the public participation scheme?
I'm not aware of any public participation scheme requests, Chair.
Thank you. Moving on to the substantive part of the agenda, I would like to welcome at agenda item 6 the Cabinet Member for Children, Young People and Health, Councillor Wright. Welcome, Councillor Wright. You're going to give us an account of performance within the CPOR relating to your portfolio. Would you like to crack on?
Thank you very much, Councillor Forster. I think there's quite a detailed slide pack, and I wonder if actually it's better that I just talk through a few of the slides rather than all the slides, so that we can have more time for debate and discussion. As you know, I'm a Cabinet Member for Children, Young People, Education and Health, and the presentation is divided into 2 sections. So we've got the Children, Young People part first, and then we've got health as the second part. Before we go to discussion, I just wanted to point out some real achievements we've had over the past year. We had an outstanding ILACS inspection, so that's inspection of our children's social care, and they couldn't find any fault, which is something which is incredible, and a massive thank you to all our team who worked tirelessly to develop a really high level of children's social care. And then the other thing is our schools remain good and outstanding through all their Ofsted inspections, so we've got some really positive achievements here in the borough over the past year. And then when it comes to health, we've recommissioned our sexual health services and have secured a much better deal for our residents. We're improving our data collection. We've got lots of initiatives focusing on prevention and healthy lifestyle. So there's some really positive achievements there. I would be happy just now to talk about our risks and our next and how we're mitigating against those risks. And I think if you're happy with that, that might be a better way to do it. So if we go to slide 12, so this is looking at children and young people's service risks for the coming year. Is that right? Have I got it on the right one? Yes. I've got there's two. There's 12 and 13. Is that right? Yep. Oh, sorry, yeah, because you've got an agenda pack. Sorry. I'm sorry. I'm looking at the original slides. Yeah. Yeah, that's the same one. Okay, so we're really busy. It's really busy in children and young people. It's very exciting. We've got some great things coming through. We've got the Best Start in Life hubs coming through. We've got the Families First programme. So there's some really great initiatives going through. We also have the SEND reform plan, which is replacing the safety valve plan as much more focused on a partnership approach. So there's some really, really positive things coming through. But at the same time, with that, there's a large burden of work on our team and a lot that we're trying to deliver in a relatively short amount of time. 2 slides on, there is actually a timeline, but it's quite complicated. So, I mean, I'm happy to talk to that, but that just gives you an idea of all the policies, the interventions, the sort of pathways that we're hoping to follow as we deliver this improved package of support for families and for children of all types. So, you know, from SEND to everyday sort of 0 to 19 support. So if we go back to that slide that's on your page 30, staff recruitment and retention, we're doing okay, but obviously it's something that requires ongoing monitoring. I was just speaking to Gronya just now, who's our Director of People, and she was saying that we're currently doing a review of our pay structure, but we also have some really great initiatives like Grow Your Own, so we offer apprenticeships and things within the organisation, so you can work up, and we offer training and various things as incentives to help people stay. And as I've just said, we've got the Best Start in Life, Family First programme, SEND reform, and then and of that, obviously there's quite a big impact on staff because they've got to deliver, but at the same time they've also got to report on all these various strategies and prepare plans to deliver various strategies. So there's quite a lot of burden on all staff, and especially senior staff. And again, obviously, delivering the SEND priority action plan, which has come out of our Ofsted report. When was that? Last year, was it? Yeah. It's been a blur, but yeah. So out of the SEND improvement board, we've also got our SEND priority action plan, and that's also sitting alongside our SEND reform work that we're doing as well. So there's quite a lot going on there. And then if we go to the next slide.
Just on that one, probably easier as we focused in.
Yeah.
So I think what I'm hearing is, in addition to dealing with the demand capacity balance around children's social care, the provision of EHCPs, we are also about to take and understand and implement a whole series of new policy areas. So you've got 2 problems eating the same resource, in effect. One of them is your senior leadership to turn around, and it has done a good job, and I see that in the figures relating to EHCP provision. And now you've got the requirement to provide a whole series of documents and strategies which are vital to clear our high needs deficit, all at the same time. And so I'm kind of asking, how are you going to manage that risk of not being able to do both the demand in terms of policy and the demand in terms of need?
Thank you. That's a very good question. Before I answer that, I would say that because we have kept some of our initiatives going, so when Sure Start closed, we actually kept a local offer of an equivalent of Sure Start. So things like introducing the Best Start in Life plan have been relatively, I mean, maybe that's a bit flippant for all the people that worked on it, but it's been relatively easy to introduce some of these new initiatives. But you're right, there is that, we have got that challenge of delivering on day-to-day work and then also delivering on plans and reform plans. The way we're doing that is we're splitting up work. A good example of this is when we had our most recent Send Improvement Board meeting, only one representative from the Parent Carer Forum was there because the other one was working on the Send reform plan. So we're being much more careful with people's time and making sure that people aren't wasting time in meetings when there could be someone else representing them. So there's that awareness that we have this risk and that we're doing all we can within sort of managing our senior staff's time. I don't know if Grania wants to add anything to that or if this is the right time to ask her, but there's definitely challenges there, but we're working on them.
Just on this slide for commission members, is there anything else you'd like to ask specifically off this slide for Councillor Wright at this point? Okay, Megan, do you want to... Oh, sorry, Robert?
I was just going to ask about the recruitment and retention issues you touched on. The Employment Committee has spent a significant amount of time looking at plans and processes to recruit and retain staff. I just wondered what the landscape was like at the moment for both recruitment and retention.
I think we're quite good at retention. I think we are in a very challenging atmosphere where there are lots of new initiatives coming in, so lots of council looking for more specialists. So we have this challenge of trying to get from the same pool, which is often quite a small pool. So recruitment, I think, it is a challenge, and that's why we're going back and reviewing our pay structure, and are we at the same level as our neighbours? We certainly were slightly higher than them a few years back, but is that still the case? So we're looking at things like that. And I mean, obviously retention is really important in these situations because recruitment is can always be a bit of a wild card, and obviously it takes a while for someone to get up to the right level. So it's retention is obviously our priority, but yeah, recruitment, we are hoping that with this new review of pay will be as on a par with our local authorities, if not offering slightly more. Thank you.
Yes, you've got a supplementary.
Yes, just to follow up on that. I've lost track, and you'll have to forgive me, with where we are with apprenticeship schemes in relation to employing and training people to become qualified social workers within the borough. So I'm not sure where we are with that. Perhaps you could help me understand.
Well, my understanding of it is that sometimes people come in as social work assistants and they're seen as being quite promising. So then they're offered to go on to a social work training course. So that would be my, is that my understanding of it? I mean, yeah, so I don't know if you call that an apprenticeship in the purest form of apprenticeship, but yeah, so there's that offer of training within on the job and going off to college, you know, being sponsored to get a qualification in social work. I don't have the figures on how many people come through that system. We could get them for you. I'd be interested to know myself, actually. So we could look at that and get back to you. Thank you.
Roy, you had a question?
Yes, two very quick questions from me. The first is around staff retention, which you've already touched upon. And the other is around consultation with and engagement with the Parent Carer Forum. Around staff retention, I'm aware from my own recollection that hanging on to the staff who manage the EHC process is always a challenge. They're under unrelenting pressure. For me, that's always been a weakness, and I'm just wondering to get some reassurance from you about that. And the other thing is about the Parent Carer Forum. We have a great Parent Carer Forum, and I know from my own experience how much effort they put into it. But the concern that I have is around how wide is that representation? Are we sure that the wider parent body is tapping into and has confidence in our PCF? Thank you.
Thank you. I'll answer your second question first. We have done some independent work. It came to the Send Improvement Board, I think, in the last meeting, and it managed to capture 1,000 voices of Send parents. And you're right, the people that are very engaged with the day-to-day work with the council are a small group of people. However, what was quite interesting is when they did this wider study, we commissioned this study, so it was done separate to the council. When we did that and spoke to 1,000 parents, we were hearing very similar messages. So you're right, Councillor Bailey, in that we probably haven't got enough voices coming directly to us, but what was reassuring was to hear that the concerns that the parents that were interviewed as part of this work were very similar to what we were hearing from the PCF. Now, your first question, so just remind me, so it's with regards to retention and...
It was the team that runs the EHC process. They work phenomenally hard, it's unrelenting, and I know we need to really do what we can to hang on to them.
Yes, I agree with that entirely, and that has been flagged as quite a risk. So we've actually recruited an extra, or we're in the process of recruiting an extra member of admin staff, because the people delivering on the Send Reform Plan are also doing a lot of the admin, organising meetings, etc., etc. So hopefully we're going to have some additional help there for them. So that's the plan. Thank you.
Councillor Harrison, you had a question?
Sorry, I think I've jumped ahead a couple of pages. If we're going to go on to priorities for 26, 27, I'll wait for that.
Jodie?
Hi, just on, so you say that a lot of the services are under pressure. So the statutory services are obviously under huge amounts of pressure. I was just wondering which ones are currently at capacity and what's being done to relieve that pressure?
I'm not sure, but my feeling is that everything's pretty close to capacity. Yeah, I mean, you know, we run a very tight ship here. There's very little, as you know from doing budgets and things, there's very little wriggle room. But yeah, I mean, what's been really inspirational in visiting things as I've taken on this portfolio is how well people help each other. And we talk about silos, but actually it's been really interesting, like visiting the Best Start and Life Hub, to see how well people spoke to each other and shared the workload. And so I think most services are at capacity, but I think we've got some fantastic staff here who really are dedicated to doing the best for children.
Thank you.
Do you want to move on, Megan, to...
Okay, so I've talked to both of the risk slides, have I? Yes, I think I have. So that's slide 30 and 31 in your pack. Right, so I'll go on to priorities. Okay, so as I was saying before, the Send Reform Plan is a really good example of good co-production, working with families, working with parents, and just trying to change the way we plan. We're planning our response to our Send cohort. We've got this new Families First programme, which is looking to combine early help. So at the moment we've got early help and child in need, and it's looking to make that a whole lot smoother, and really put the family at the centre of that work. And I mean, what's important, or what's kind of worth noting, is that we've got the biggest reforms to children's services since 1989. So there are some huge changes happening. And so the Family First legislation is it's removing targeted early help and child in need and bringing them together to create this family help service, which would be much more multidisciplinary. But at the same time, for families, they will have what they're saying is they'll have one assessment, one plan, and one lead practitioner, so they're not having to constantly retell their stories, they're not being shifted from pillar to post, they have a clear understanding of how we're going to support those families. So that's our Family First programme. Best Start in Life programme, I've already talked about that. We've got the whole plan is to have some hubs and spokes. So I went to visit the Rowans in East Hampstead. Really fantastic programme, loads of support there for families, ranging from people escaping domestic abuse and coming to a domestic abuse session to soft play for children, to the BHFT nurses being there to do immunisations and early child checks. So some really good stuff there going on in the Best Start in Life programme. And then obviously we've got the Centre Reform Plan and delivering not only our priority action plan in response to our Ofsted inspection, but also delivering the reform plan in response to our hope, with the priority of moving from the safety valve programme into the reform plan, and with getting the new school at Bucklers Park. And then, again, one of the other things we're doing, and this will hopefully come through with the Families First, the Best Start in Life, is trying to narrow that gap between children who are from disadvantaged backgrounds, who aren't doing so well at school. And so that's working with the schools to support them. One of the things about the some of the new legislation coming through is that we're going to have something called Experts at Hand, which is a new initiative to have people who are experts on child development at hand for every school. So every school has got a child development expert to call on. So that should hopefully help with, identifying children early who need help, and trying to work out how to, trying to tailor support for them. And then obviously we've got our plans to open the new SEMH school in Warfield, and we've just started our special resource provision in Edgebarrow and Sandhurst to make sure those are delivered well. So, yeah, I think that's our priorities. Yeah.
So just a couple of questions. So recognising, obviously, you have cabinet responsibilities for the priorities as we move into 26, 27. In order for you to feel comfortable around delivering these priorities, have you already, for instance, identified the key metrics? I'll give an example. Improve outcomes for disadvantaged pupils. Are you confident that those priorities numerically, so quantitatively, are within the reach of the resources that we currently have? And do you understand what those metrics are going to be and what resources you need to flex to make it happen?
Yeah, thank you for that question. With regards specifically to disadvantaged children, I think that will be designed in collaboration with the schools and our education partners. So I'm not entirely sure what indicators we'll be using there, and I can find that out for you. With regards to other metrics, we'll continue. We have compared to other local authorities, we have really good statistics on children looked after, children in need, children on child protection plans, but it's continue to embed that, look at good practice. So those are our metrics that we use for example, children looked after, and monitor. And then with regards to SEND, we're looking at our educational health and care plans and where that child is getting their education from. And we're hoping with these new developments within the borough with regards to Forest View School and the school in Warfield, and our special resource provision, that we'll have more children, that children will be educated in where they live. I mean, so that's something that we're aiming to do. yeah, so there's data. We're collecting data and metrics and all of this. I mean, I could, if you want, I think that's probably quite useful to give you that list of all the things that we're collecting
please.
data on. Yeah, okay, happy to.
Just additional questions. Jodie first.
Yeah, well, you touched on the budget, so I have two questions here. How are we mitigating the rising costs at this point? And the other one, which I think is relevant at this time, is amongst the rising changes and the rise of freelance SEND specialists who charge for their services, what are we doing to signpost our services to make sure that parents go to the right services for them?
Thank you. So that's mitigating rising costs and signposting. Okay, on the signposting, we have the Information and Advice Service, IA. I think it's slightly longer than that, isn't it? I can't remember. Anyway, it's not IAS. There's another letter in it. So we do IASS. Thank you very much. So we do, Information, Advice and Support Services. Yeah. So we have the information which is accessible to any parent who's concerned about their child. Hearing very good feedback about that. Through both that survey that I talked about earlier and through the PCF. So there is that advice there for people if they want it, and schools should be signposting their children to parents to that if someone's concerned about their child, as should GPs, social workers, etc. And they've got a wealth of information for parents. And then with regards to mitigating against rising costs, I mean, obviously we're really keen on these investments in these new schools because that will bring down, not only it will be better for the children because they'll be learning in the place where they live, so they'll be making friends with people who live locally to them. They won't be sitting in cars every day for hours on end getting to and from a school. So, but not only that, but it will also help us reduce our annual. Yeah, exactly, and and just the transport and all the other things. So that's something we're doing, mitigating against rising costs. But we need to be honest here. Our EHCPs, like the rest of the country, are going up every year. I mean, they've slowed down a bit, but every year we have an increase in number of children needing an educational health and care plan. So we're doing what we can. And we hope with the SEND reform plan and our strategy to open a new school, etc., that will help. But yes, it is a challenge. I won't pretend it isn't.
John, you had a question.
Thank you. Yes, looking at the slide about the number of different national reforms and changes that are going to come through. I mean, with every change in policy and procedures and so on, there's going to be changes to computer systems. Have you satisfied, do you know how many changes are going through that are going to have impact on the services you look after? And have you satisfied yourself that the council has a plan to implement these smoothly and without risks to service? What questions have you been asking of officers?
Thank you. I mean, I need to ask more questions about IT. I know that we have a good system. I can't remember what it's called, but I know we also use something called the Outcome Star and the Family Star for our social work assessment, which is an online tool for assessing families, and that we use. We do have a casework file, but you're right. I probably need to find out what's happening there. And also the other thing is obviously we're not working on our own. We're working with the NHS, we're working with education, and obviously part of that national debate is how are all these different systems going to talk to each other. So thank you. I will ask that question and hopefully get an answer to you. Let me write that to my list.
Could I say, having had sort of some experience of working with NHS systems, I'm not massively confident, and you need to be on top of them where there's data interchange. You're quite right in emphasising the importance of having good data. But good data relies on the systems actually being up to date with the policies that are being implemented at the same time.
Yeah, I agree entirely. And actually, when we move on to public health, that we're doing some work on data there. But I'll follow that up. Thank you.
Jodie?
Just on that, and you can come back to me with this, but on the digital systems that we have, when was the last time they were updated? How efficiently do they run, and do we face any delays with them, please?
I haven't been told of any, so there haven't been any that have got to a level where it's been a risk that that the officers have needed to let me know. So I think at the moment the systems are coping. But yeah, so I think everything's okay. But as Councillor Harrison said, it would be good to get assurance of how is this all going to work moving forward. Thank you.
Okay. Do you any more questions on this? Jerry?
Okay, thank you, Chair. Am I on? I'm on now, aren't I? Yes, going to the slide on priorities, and it's to do with the implement the best start in life. And right at the end, it says about workforce support to give the children the best support, the best start in life. What do you mean by workforce support? Is that sort of in the whole borough, implementing nurseries, or is that just for the council workforce support?
I think it's wider. It's across the whole borough.
Right, okay.
We were talking about this. I can't remember who I was talking to, but teacher training doesn't cover SEND enough. So we've identified that as an issue. So there's going to be some more in-house training for people in education, teacher assistants, etc., to understand various issues with regards to managing children that might be learning differently, and I know there's a budget for that, and there's a plan. When I went to look around the Rowans, I was talking to Cherry Hall, and she was talking about that plan of how they're going to improve. You know, how this whole Best Start in Life programme will include a training programme for people engaged with children.
I think it sounds quite exciting, so thank you for that. Thank you.
Thank you. Yeah.
Roy, you have a question?
Yes, very interested in the experts at hand offer. That sounds like the right thing to be doing. Will it be possible at some stage when it's practicable, if I can say that, to have some anonymised versions or experiences, examples of how that's been delivered and what the effects have been?
Yeah, I think that's a great idea to have some case studies, and also, you know, across the borough, we'd hope that various experts at hand would learn from each other. We're not entirely sure how experts at hand will look. It could be that different trusts have 3 or 4 that have different skills. It's something that we're going to be doing in partnership with the education people. So yeah, and I agree, Councillor Bailey, it'd be great to have some really, success stories, case studies, lessons learned, etc. Thank you.
Jenny?
Is there a timescale for the experts in hand? Yes, or is it still to be?
Yes, there is. It's quite soon. I believe it might be September. Yeah, it is. It's September this year, which is a very, very tight turnaround.
Excellent news.
Yeah, it's excellent news, but it's going to be tough
As long as it,
finding
as
the
long
right
as it
people.
happens,
Yeah,
as
Yeah,
I hope
yeah.
it will.
I agree entirely. I think it's very much needed, but it is going to be a challenge. Thank you.
Would you like to move on to public health?
Sorry, I don't know the numbers of your slides, so I think if we, what I'd first like to say is we've been doing some great stuff in public health. We've got a really good team. As I said earlier, you know, we've improved our offer with regards to sexual and reproductive health. We've improved our working relationship with our health partners, etc. However, I will talk to slides. So the second and third last from slide yeah. So is that capacity and prioritisation at the top? Yeah. Okay. So capacity and prioritisation. So maintaining delivery across statutory duties and commission services while shifting upstream and building neighbourhood health. And I'm sure you've all heard the hospital to community, treatment to prevention, analog to digital, and while they're great sound bites, there's a lot of work that's going in behind those, and one of those things is neighbourhood health, which sits under the chair of the Health and Wellbeing Board. So while we're delivering our statutory duties, you know, so our drug and alcohol service, no, that sits under adults, sorry. So our sexual and reproductive health, our 0 to 19 checks, our healthy weight management, our stopping smoking service, while we're delivering all this current public health interventions, we also need to be focusing on what neighbourhood health is going to be looking like. So we've been in lots of conversations with the NHS, with our voluntary and community sector, and looking at shaping what does neighbourhood health look like. And then with regards to data and insurance, when Councillor Harrison was talking about the quality of the data, I agree with you entirely, because we had a fantastic dashboard, but as we worked to embed it, we realised some of those metrics weren't coming through brilliantly. So we're now working with we've now built a, sorry, let me find my notes in this one. So we've now got some additional funding, and we're having a local authority research practitioner, and we're also looking at how we work with local universities, and in sort of making sure that the health interventions that we deliver are research-based and based on best practice. So we're doing a lot of work in that field of making sure that we have really good data, and that we're using the data to deliver really good programs, successful programs. So that's on data insurance. I think, let me just see, sorry. My notes are a bit messy on this bit, so yeah, and and the other thing is we've also developed a network of local authority research practitioners, so that we're working with neighbouring local authorities, so that we're not reinventing the wheel. If someone's doing a great project with a similar population to us, we're working with them. But in doing so, you then need to make sure that you've got all your policies right with regards to sharing data, ethics, equalities, etc., to make sure you've done all that right. And then that's data insurance, system change risk, sorry. Well, I've kind of talked about this as well. This is we've got all these new changes coming in, neighbourhood health. Also, I'm sure you're aware that the abolition of NHS England, ICB's having to cut their number of staff, so there's quite a lot of pressure on the NHS and our partners in the NHS, our senior partners in the NHS. So you know, that's something we're having to manage as a council with regards to risk of with our partnerships. And then workforce resilience, we've just recruited a new consultant in public health, which is great. So I think we've got a full quota, and also having this extra support with regards to having a research practitioner will really help us as well. So that's the risks in this slide, and then
just a couple of questions.
Yeah, go for it.
Could you give me an example of an evidence-led decision that you have made using high-quality data or dashboards? That's the first question.
Yeah.
The second one is, it jumps out like a overexcited jack-in-the-box, but the word burnout. Now, could you give me some assurance that actually managing workloads, delegation and burnout risks, that risk isn't going to become an actual issue?
Well, as I said previously, I think because we've recruited a new consultant in public health, and because we've got this additional funding for some public health research practitioners, I think that's really going to help with the workload across the whole of public health. I think one of the risks that we don't have a huge amount of control over is this risk our local NHS and our local ICB, because obviously they've had this huge reorganisation where Frimley's become part of Thames Valley ICB. And we're aware of that, and we're trying to accommodate that as a local authority. I think the improvements in staff will help. I think we've got very good leadership under Charlotte Pavitt, who's our Director of Public Health. She also has good relationships with neighbouring Directors of Public Health, so there's definitely a sort of collaborative working across East Berkshire and further afield. With regards to examples of successful programmes, the one I've got in my notes is actually a little bit negative, because it's about why we stopped doing our Healthy Weight programme that we were doing and how we've moved to a different programme. I think, let me just have a look. Sorry, I did ask for some evidence on this earlier. It's making no, that's too wordy. Sorry, let me find a shorter one. Sorry, I can't find it, but I did ask about, we've just changed our stop smoking kind of, well, we've just recommissioned our stop smoking service, and one of the challenges that we've got is what we call, we don't call them hard to reach, but you know, those people that don't come to GPs, people that don't come, you don't often see under social services, but how do you reach those people to get them to stop smoking? And so we're doing some work there, which has been done elsewhere, on sort of going to workplaces, working with the occupational health in larger workplaces. So there's some good work there in our new stop smoking service. Immunisations, again, we've got good figures for our immunisations. But we had some groups that, again, were hard to reach by us, and we've done some BHFT, so Berkshire Health Foundation Trust have done some good work with their health bus, reaching out to communities where there's low uptake of vaccinations. And I think that's it with regards to... I'm sure I could find you some more examples if you want.
Got one final point. You kind of brought it up yourself, and then I'll hand over to Councillor Bailey. Obviously, and this is something of interest to this commission, is the transition to the new ICB.
Yes.
Would you just give us your thoughts on what you've seen so far as we've made that transition?
I think... So I think Thames Valley ICB covers a huge amount of geographical area. I think within that geographical area there are 6, 8, I think something like 9 unitary authorities. So all of a sudden you've got less people having to communicate with more unitary authorities. We have said we are happy to work with them and help them with that, but that is a challenge. I think as we move into neighbourhood health, which I think is a fantastic initiative, we need to make sure that it's proper partnership working, in that we're involving the voluntary sectors, that we're involving the commissioned health services by the ICB, and that we do all we can to communicate with each other about what our priorities are. But I mean, it's definitely something that is a challenge. Yeah.
Thank you. Roy?
Yes, just really briefly, I like the idea of research practitioners. Is there a job description, role description for them? Who commissions them? And what type of report research can we expect back?
Thank you, that's a good question. They've come from, what's it called, public... Sorry.
It's NIHR.
Oh, sorry.
Councillor
Hello.
Wright.
That's it. So that's Charlotte. Oh, sorry. I didn't realise you were there, Charlotte, and I was picking you up. So that's our Director of Public Health. They come from the National Institute of Health Research. It's a new initiative from them to improve getting public health data from communities and local authorities rather than through the NHS. I think we get a grant from them, and then we sort of decide what our priorities are in the area and what work we'd like them to do. Is that right? Yeah.
Yeah, that's exactly it. Yeah.
Okay, fantastic. Thank you. And I'm sure, Charlotte, you will be happy to share a job description.
I've got the job description and the work plan. Yeah, more than happy to circulate.
Okay, fantastic. Thank you. Thanks.
Okay, any more questions on this particular area? Megan, you ready to move on?
Okay, priorities for 26-27. Sorry, there's a few acronyms there which I'll just quickly explain to you. Publish our JSNA, which is our Joint Strategic Needs Assessment, and our JHWBS, which is our Joint Health and Wellbeing Strategy. So these are kind of what shapes our public health for the borough for the next 5 years, and we've decided, we've had lots of workshops, and what we've decided to focus on as our priorities are frailty, loneliness and isolation, children and young people's mental health, healthy weight, and people living with multiple disadvantages. Hopefully lots of you have had your email about our health and wellbeing strategy, and we're asking everybody for their feedback, so you should all have one of those in your inbox as we ask people for their views on what we would like, how we'd like to deliver health in the borough. And then deliver our mandated public health services, which I listed. Commission integrated weight management service. So this is what we're looking at is how do we deliver a healthy weight program. We have an issue. Our obesity levels are okay. So when you monitor obesity, you monitor it at age 5. And then year 6, so last year of primary, and then in adulthood. We're okay. Our obesity rate for year 6 is 22%, and I think the national, 27%. Oh no, wrong way round. So 22%, and the national is 27%. So we have an issue with obesity, but it's lower than the national level, and we're looking at how do we support people to have healthy lifestyles. So that's looking at our food environment, encouraging active travel, health education about healthy diets. So that's our integrated weight management service. And sitting alongside that is access to GP exercise referrals, an app, a weight loss app you can use, so just lots of services around the person. And then deliver against recommendations made in the annual public health report and commercial determinants through established health and all policies approach. So this is looking at every policy you have, is it a healthy policy? So, if you've got a planning application for a chip van in an area where there's already 2 chip vans, or, 2 fast food outlets, should you be allowing that to open? Are you when you're thinking about planning new housing estates, is there the opportunity for people to walk and cycle to local amenities? So that's the whole sort of approach of health in all policies. And then providing leadership in becoming an evidence-led organisation. So this takes us back to doing our work on research and working with neighbouring universities there. And then this is underpinned by a public health target operating model. So that's health and all policies, intelligence-driven, tighten governance and performance grip through SMG. Charlotte, what's SMG? I don't remember.
Apologies. Senior management goes. So this is the senior
right.
leadership
Yeah.
group within public health. Sorry.
Okay, and then a community insight and co-production is standard approach. So we are obviously we're doing a lot of co-production, and a good example of that is our Thriving Communities programme where we're working, which is funded by the Better Care Fund. Investment in workforce development, clearer decision rights and sustainable ways of working. So this is all about supporting. We have a programme here. I mean, I've been involved in it. So there's a training programme within the council for public health professionals. So there's lots of opportunities to train in public health as well. Okay, thank you.
Thank you very much. Any final questions before we move into debate? For we have a couple. Okay, Jodie, do you want to go first?
Again, apologies because I'm going to ask this every chance I get, but what is the status of Bucklers Park, please?
It will depend on the reform plan, which we're feeling positive about. We've already submitted a version of the reform plan to the Department for Education early, so that we could get their feedback on it. We've made the changes they've recommended, and then we'll resubmit that reform plan, and then that will be our authorisation. You know, once that's accepted, then that will be our kind of green light to start thinking about building the school.
Okay, thank you. Just following up on that, under the safety valve programme, were we able to secure any other capacity for SEND placements in the borough? Sorry. and if so, how are they going? And as a second part to that, are there any risks in the changeover from the closure of the safety valve programme to the new programme?
Thank you. Obviously, since we started the safety valve programme, we've opened the new special resource provision in Edgebarrow and in Sandhurst, and we also have created Hawthorne Academy in the old College Hall site. So actually, we've put in a lot of new provision, which is fantastic. What was the second part of your question? Sorry.
Basically, in the changeover between old and new, what risks are there to the SEND community and the continuality of it? I think moving from the safety valve programme, which is very much a top-down approach, we didn't do any consultation. Well, you know, because of the pace of when we had to submit it by, there was very little consultation with families, with children, with schools, whereas the reform plan has had to be co-produced, so we've had to work with families. So actually, I'm relieved that we're doing the reform plan rather than the safety valve programme. I think it makes sense. So I think we're mitigating against risk by replacing the safety valve programme with the reform plan, if that makes sense to you. Yeah, thank you. Yes, thank you. That's good to hear.
Sorry, is it you, Jerry?
Chair. Just a quick question, really. It's going back to child obesity rates at 22%, which is better than the national average, but it's still a fifth of our children's population. It's a question about school meals in academies, which are schools, and I just wanted to know how much of an impact do we have? Can we scrutinise the menus and what they're eating, or is that something that the schools take on themselves? I'm just looking at healthy eating when they're at school.
Thank you, Councillor. That's a really good question. Charlotte, are you able to answer on that?
Yeah, we don't have authority over their menus. However, we are working on developing a healthy schools programme of work that does include healthy food choices and working in a proactive way and building those relationships with the schools to educate them and to work with them to facilitate that. So yes, there is a route through to do more work on this within the healthy schools agenda, and that is firmly embedded in our whole systems approach to healthy weight. So the schools is a fantastic target audience and way in which we can influence some of the food choices during the school day, but then also the behaviours when the children go home in the evening too.
That's lovely, thank you.
Thank you. I got my obesity statistics right, didn't I, Charlotte?
Yes, that's right. So, yeah, so for children and young
Yeah.
people, yeah, it does
Yeah.
benchmark
Yeah.
more favourably against nationals, but like you
Okay.
say, nearly a quarter are still overweight or obese.
Right, brilliant, thank you.
How are we going to measure if these interventions are working and whether they're worth continuing with, or we have to take a different approach?
So certainly with adults that are on GP referrals, they'll be monitored closely, and some of the exercise programs that kind of sit alongside the GP referrals, but you can opt into them without actually going through your GP. All of that is monitored quite closely. If a child is identified as being overweight in school, they're then followed up by the health visitors. So there will be further follow-up, and obviously we get that data. So that's how we'd monitor the actual metrics of how children are doing and adults are doing with regards to obesity. What would be interesting to know, and I'm hoping that when we've got all this, now we've got this research team, is looking at, well, what did those people do that have lost weight, and what were those people doing who didn't lose weight, and try and understand that a bit more as well. So I'm hoping that as we improve our sort of data, that we actually have that ability to analyse that and find out what's working. Thank you. Is that okay?
Okay, thank you. We'll bring your moment in the sun to at the end as we move into debate. I'm going to replay some of the things I've heard just to kickstart the debate, and please do join in. So, EHCPs are still rising. They're still rising, and therefore demand is still rising. There have been lots of good work that the officers and the members have put in place to try and mitigate the challenges that we've seen. Just as this sort of challenge is starting to be got on top of, we now have a completely new set of government legislation. So not only are you dealing with the original, which had some fundamental flaws, and you've got demand still rising, you've also got to understand what the implications are of the new legislation is, and in particular, in order to clear the 90% of the is it DSG? Is that the correct phrase? Of whatever it is, the tens of millions, 17 million or whatever it is, we need to have that particular plan signed off. So you've got two challenges simultaneously going on to the most stressed part of our council, and that says to me that there is a huge risk. So currently in our strategic risk register, it's safety valve. Actually, that's clearly moved on. We are now in a phase where it is the new reforms plus the existing legislation. So for me, I'm seeing a hugely intense period of stress that the community of officers and parents and members who work in this area are going to have to deal with. That says to me that area needs to be supported, those risks need to be mitigated. Are we confident that we've got everything in place? So I start there, sharing that concern. So any other thoughts? Rob? Jodie?
I mean, this may just be a curiosity factor, but so obviously we know that a huge percent of our budget goes to, not necessarily towards EHCPs, but into providing educational settings and transport to children going outside of the borough. I mean, one of my own children being one of those. I have, to my detriment, I have Googled the term fees of this school. What I'd like to see is kind of like a breakdown of how much of our budget for SEND children is spent on term fees, and is there any way that we can... Is there any way that it can be brought down? I mean, if we could imagine possibly that this money was being spent on a school I mean, imagine the weight load that would be good. I would like to see some numbers is what I'm getting at.
Just so I can focus that in. So what you're saying is we recognise the legislative landscape, we recognise the demand. There's also cost pressures that you have concerns are increasing, which again add to the complexity of that landscape we've just painted, correct?
You said it so much more eloquently, Chair. Thank you.
Roy?
Yes, it's a big challenge. The direct schools grant or the high needs block is going to be a big challenge for us. But leading on from that, my concern always is that we communicate, consult with the staff, the SENCOs, head teachers, as well as the parent carers as well, to make sure that we're on the same page. But it is a massive undertaking, and I know just how hard everyone is working, because I was there and I've seen it, and I think this has added additional momentum to it. But for me, it's about making sure we're in tune with the staff, that we consult with them at every stage, and we get feedback from them at every stage. Similarly with the Parent Carer Forum too, an important part of this whole ambitious thing that we have. I'll stop there because I'm starting to waffle, but thank you.
Robert?
I was going to make two brief points, but I can't help but observe that we seem to be in the eye of a hurricane with so much going on impacting the residents of Bracknell Forest, whether it's the change to the Thames Valley ICB or whether it's the demographic time bomb or falling birth rates, staff retention and recruitment. There are so many issues with which we've got to wrestle, not least, of course, the new school at Butlers Park and everything else. So there's so much going on, it's almost impossible to get reassurance that because there is so much going on, we can cover all those bases adequately with the very limited resources Bracknell Forest has got. But if we do raise our eyes to above the horizon for a moment, because it's all too easy to get trapped in the trenches dealing with all this on a day-to-day basis. But there is a significant risk of a falling birth rate that will impact Bracknell Forest and pupil numbers in the future. I don't know how far off that is and whether any work's been done on modelling what impact that might have on Bracknell Forest. But also with the combined authority in the wings as well, what assurances are we seeking that the priorities for the residents of Bracknell Forest will mean we get a seat at the table, whether it's talking about health or anything else, to make sure that our priorities are being recognised, accepted, agreed and implemented by the NHS in whatever model they are adopting? Because my concern is that we will be a very much smaller part of a much bigger whole, and I'm not confident that with the limited resources that NHS, ICB, Thames Valley will have, whether they're going to be able to listen and react to what we regard as our priorities for Bracknell Forest. Sorry, that wasn't a question.
Sorry, it's no question. It's a debate. This is the right time for that. Any more points are in the debate? Jodie?
I would like to see what kind of okay, so I will try and keep this short. So obviously EHCPs are a big cost factor, but not every special needs child needs them, and schools are sometimes able to help that with obviously early intervention. What programs specifically are we providing to our local authority, to our local schools, to help mitigate the need for EHCPs is one question. And the other one on how are we keeping track on communication between the health departments and our residents / patients. And I have a separate question on feedback, but I'll get that in a minute.
Okay, recognising we're in debate. So, looking at potential recommendations, which is where we need to get to, the first one that it comes to mind is there is a risk that the overload of an overload of legislation and demand and increasing costs that there is a risk to our provision of essential services in the children's social care domain, and that measures should be explored to how to mitigate that risk as urgently. We are raising a red flag that there is an issue here from what we've listened to today, just the sheer volume. Okay. The second recommendation is early review on how the Bracknell Forest residents' voice can be heard in light of the reorganisations that have started to take place in the health domain, and how we can start that process.
Yeah, I mean, I think monitoring communication is going to be very key here, not just with our patients, but also those that look after our residents, so social care workers. How do we get feedback from them as to how everything is progressing?
As in with the ICB? Yes. I think we're going to have to... That's obviously an area of a review that we're going to do as a commission. I think what we're just asking here is for early perspective on making sure that there is an expectation that our voice will be heard. That's what we're just saying on that one at this point. Jerry?
To add to that, with the voice to be heard, I think it's important to put into this recommendation that we want every communication possible from the Thames Valley ICB, so we know what's going on, and that's a big concern of mine. So they need to communicate to us. They need to listen to us, but we need to hear what they're telling us, and we're not getting that communication back, I don't think.
So the recommendation is that the Cabinet member seeks assurance from the new ICB Thames Valley that communications from that body are passed to her in an accurate and timely way. Okay, that's 3. John, have you got one?
Yes, and it comes very close to what you were saying about the huge amount of change, is that the Cabinet member needs to be aware of any systems changes that are going through that could impact service delivery or the ability to deliver to the change services that are being required.
Okay, so we've got 4. Dare I say it, Sharon? Do you want to just give us a synopsis and we'll just refine?
So the first one is that the Cabinet to review the risks arising from the increasing legislative requirements, rising demand and escalating costs with children's social care, and identify urgent measure to mitigate pressure on central services. The second one is that an early review to be undertaken of how Bracknell Forest residents' voices will be heard following reorganisation of health services, including how this process will begin and how communications with residents will be monitored.
Can you start that one again for me?
Yeah, so that an early review will be undertaken on how Bracknell Forest residents' voices will be heard following the reorganisation of health services. Shall we stop there?
Reorganisation of ICB Frimley to ICB Thames Valley.
And then the following one is the Cabinet member to seek assurance from Thames Valley ICB that communications is passed in accurate and timely way. And the last one is the Cabinet member needs to be aware of any system changes that will impact service delivery.
Following the legislative changes that are imminent. If everyone's content, we can do those in a group. Is there anyone that would like to break them down into individual recommendations? No? Okay. In that case, I propose the recommendations that the clerk has read out. Do I have a seconder?
Happy to second.
Jodie is seconding. Votes for. That's unanimous. Thank you very much.
Thank you very much.
Thank you very
Hannah.
much, Megan, for attending. We now move on to agenda item 7, where we welcome the Chief Executive, Sue Halliwell, and the Leader of the Council, Councillor Helen Pennell, who are presenting the Council Plan Overview Report covering the 4th quarter of 25-26. So, first of all, welcome to you both. This is quite an exciting moment. We have used a new approach to analyse the performance of the council, including the use of AI to analyse the very detailed CPOR against the strategic risks, the 7 strategic risks that the council manage. So you will get 7 major components aligned to those risks, and I've asked the various panel chair and myself to take the top 2 questions in that category. So and with the aim that if you could provide answers more broadly to the other questions in slower time. So let's any questions first of all about how this is going to work?
No, that's absolutely fine. I'm not sure I'm cited in the broader questions, so the additional questions, or the initial ones. So it's just to be clear that if there are additional questions, if we can have sight of those as soon as possible, and we'll get them responded.
So the ones I've got are the ones that I provided on Tuesday, I think it was. Have they changed? Well, we'll see how it goes. Let's see what happens.
I'm looking forward to it. It's fun. It's a new opportunity.
Absolutely. Good. Right. So I'm going to commence. And this is really around the financial stability. So it's taking the data that has been provided, and it's in a very high quality, granular state. High level perspective, this quarter had a number of positives, so I'll just sort of start the big picture. I see that Children's Services Inspection, the Larchwood outstanding from Ofsted, and obviously the Forest View funding. There were a number of challenges, in particular the fair funding review, which was anything but. The challenges that children and adult services continue to experience around demand and the pressures that they're under, and I think Councillor Wright has just described them. And I also noted the sort of lack of affordable homes that were completed against the local plan 4 target of 35%, and there's some other things around recycling. But broadly speaking, there were some positives and there were some negatives. On the financial stability, the first question I've got for you is there was a 2.657 underspend 25-26. Does this underspend change the overall approach to achieving a balanced budget for going forward?
So as the Commission will be aware, the budget that was set for this coming year, this current year that we're in now, included the reliance on 5 million of reserves. So based on the performance of last year, looking at those one-off savings that have been made, but also understanding where there might be potential to make ongoing savings, we're going back through that process to understand where we might be able to bank additional savings. So we're doing that with a view to implementing those within at the end of Q1, beginning of Q4. that's like the whole year, sorry, and end of Q1, beginning of Q2, so sort of before the summer, have a clear understanding as to what those are, so that we can make a contribution to reducing the reliance on the reserves. So the short answer is yes. There's a longer way in which we will have to analyse to make sure that we can definitely bank the savings.
That's good news. The second question I have... Yes, sure.
So, given what we've just heard from the Cabinet member about the pressures that we're under with everything that's going on with the health service and special educational needs and everything else, how confident can you be that with resources being so stretched, we will be able to find additional savings?
So there are a number of approaches that we would look to investigate. For example, there are examples in last year's performance where we generated additional income that we weren't expecting. We would need to look back at that and understand, have we been overly cautious in our income projections this coming year? Could we do better? Are there different things that we could do to generate that income and bank that? So I think there's, in some areas, there is a degree of confidence, but you're absolutely right. What we always carry within the budget is a degree of risk. And so there is, for example, the children's budget, there is always a degree of risk that we go into each year looking at the demand and making assumptions around that. So can you always be 100% assured? No. But what you need to be able to do is those that you are going to bank, you have to have assurance that, yes, we will be able to deliver them without any services falling over.
Let me just finish the next question, and I'll bring you in. Yeah, John. So, children's social care reported an overspend of 1.62 million, and education and learning reported an overspend of 1.025 million. Can you just give us your perspective on why there was an overspend reported in Q4, and what measures are being taken to reduce this in Q1?
Yeah, so if I could put that into a context, that the overall People Directorate budget came in with a £7,000 overspend at the end of the year. That is unheard of, I think, for combined People Directorates in most local authorities. So they've performed extremely well. However, there are, as you pointed out, some areas that have seen specific overspends. The children's services, as we've reported to the Commission previously, we operate a family safeguarding model, which means we look after the whole family when there are issues that relate specifically in this circumstance to the children. We do whatever we can to keep those families united. Sometimes complex cases arise, and that's what I mean by we manage the risk. So we will be managing that risk on a day-to-day basis, literally a day-to-day basis. Sometimes those situations become more complex, and then we do find ourselves in a situation where we have to look for expensive placements or additional foster places, for example, that we hadn't anticipated. So whilst it might seem a significant increase, actually, because of the family safeguarding model that we've had historically, it's the cost and the increase in costs that we're seeing is relatively low if you compare performance against other places. It also means you've got longer term success. So the consequence of these scenarios costing us more in the future are reduced. So that is some explanation around the children's services overspend. The other point I would also make is we did set aside not quite the exact amount, but I think it was 1.2 million set aside in our contingency budget to cover any additional risks that may emerge from children's services. So we did manage that through that process last year. In terms of the overspend in education, I think that predominantly is fleet and transport. So we've just touched on home to school transport for children that need to be educated out of borough. We've seen a significant increase in that, the cost of that. There are other areas that contribute to that overspend, and we've touched on it. SEND services support is one of the areas where we have seen slight overspend that adds to that overall 1 million.
Thank you. John, is a financial question?
The question is, in terms of the overall underspend from the previous year, how much of that was down to delayed spending that's going to have to be spent in the coming year, whether that's revenue or capital, which then obviously has a funding implication?
Yeah, so I don't have exact figure for you just yet. And what I have asked the organisation is, well, if it's delayed, what's the consequence of not doing it as well? What has been the outcome? What has been the impact? So we're just going through that assessment at the moment. So I don't have that exact figure, but that is part of the process of what we're looking at. And indeed, if it has been delayed, is there additional cost now in picking it up? If so, we have to challenge that and make sure that we bring it in on budget or under budget.
So in some past years, we've had underspends, or we managed to keep budgets down because we haven't filled vacancies. But at some point, you either have to decide whether those vacancies, those posts get filled, or you fill them by agency staff or other means. And so I'm wondering what the implications are. Are we short on service, or are we saving some money at the moment deliberately, or are we unable to hire in certain areas, and is that having an impact?
So we still have vacancy factor. We call it a vacancy factor. So that's still applied to all staffing budgets. So we still carry that as a matter of course during the course of the year, because we know there'll be churn. My mind's just gone off the topic of what I was going to cover off. Sorry. Agency staff. Yes. Thank you. Thank you very much. Because. Thank you. We've run a really successful programme looking at reducing our agency costs. So the cost avoided is significant, and there's actually a paper going to the Employment Committee in the not too distant future that has a much greater detailed account of what we've done to reduce and avoid cost of agency. So we're moving people to permanent so that we have that permanency that we need to deliver services. So in answer to your question, we're retaining staff quite deliberately. We have a programme that's called Retention and Recruitment, not Recruitment and Retention, and that's quite deliberate. We've reduced our reliance on agency, so we're reducing that high cost spend, and we're maintaining a vacancy factor. So we've got a solid, very strong workforce. We have got pockets of challenges still, but I think despite all of that, there are still these challenges with these changes that you've alluded to at the previous item.
Financial question, Jodie?
Just quickly, specifically on transport for out of borough, what's been being done to reduce that, because it comes up a lot?
Does indeed, yeah. We have a specific programme at the moment. We're just scoping it out to look at reviewing the whole service and the contracts and the going so far as the route planning to make sure that we're providing the right service in the right place and as efficiently as we can.
Yeah. And longer term, it's to have these children educated within the borough so that transport costs aren't required.
Okay, moving on to the pressures on the local health system. Jerry, would you like to ask your questions?
Okay, thank you. It's two, isn't it, we're doing? Yeah, okay, thank you, Chair. So my first question is, it's a question on recognising the NHS health check performance is still red from Q3. Is this situation a data or an actual problem? And if it's an actual problem, what steps are being taken to mitigate the risks?
Thank you. I don't have the details on the mitigation with me this morning, so if I can take that away, and I will get back to you on the details of that.
My last question. I think this has been covered, but I'd like your stance on this. So the question is, what are the council's initial insights into the new relationship with the ICB Thames Valley?
So I can give you an officer experience, and then I think the leader might be able to might want to give her view as well. Quite understandably, when you are setting up a multi-billion-pound organisation in 6 months, there's a huge amount of work that has to do to set up so that they're safe and legal from day one, and they have done that. And they have communicated as much as they possibly can during that process to say the work that they're doing, the commitments that they are making to delivery of services, etc. They have established their board, so in governance terms, they're safe and legal, and we have set up technically they're informal meetings because they don't form part of their the ICB's formal decision-making process. But we have informal meetings of the local authority chief execs with the ICB chief exec. The directors of public health have a meeting. So we have a structure that ensures the right level of engagement. It still is only June, so I think there's still some bedding in. We're still very mindful that they are implementing their new structure. We're still very mindful that staff don't necessarily yet have certainty, but what we are finding is everyone's working with the utmost of professionalism and commitment to what they're looking to do and to the place as a whole as the Thames Valley.
Yeah. Likewise, their commitment and their professionalism is evident. They're clearly going through huge changes, but whenever I've met with anybody from the ICB, you wouldn't know. Professional to a T. It's obviously really hard. It's really hard for them, and like Chief Exec has just said, that we've got to let them get through this bedding in process. When you know, until we can really judge what it's going to be like.
Any questions on health?
Thank you. It goes back to one of my earlier comments. I've no doubt that the staff at the new ICB structure are going to behave professionally, as you would expect from people who work in the National Health Service. My concern, and I suspect our residents' concern, is less to do with whatever structures the NHS decides to implement. What they care about is how it's going to impact the level of healthcare provision that they get as residents of Bracknell Forest. My concern also is whether anybody at NHS ICB Thames Valley is going to be listening to what we regard as our priorities for the residents of Bracknell Forest. Now, clearly their audience, if you like, is going to be significantly greater than it is at the moment. So I suppose my question is, how are we going to make sure that the professional people at Thames Valley ICB are listening, hearing and responding, reacting positively to what our residents and us as a local authority need them to deliver to ensure our residents remain healthy and cared for?
So the neighbourhood plans and the work that we're doing through the Health and Wellbeing Board will be absolutely critical to making sure that we are gathering the appropriate evidence that we need to be able to feed that back into what will be the Strategic Commissioner. So they need that evidence. So the work that Councillor Wright touched on earlier on around public health, the JSNA, that will all feed into the evidence that's needed by a Strategic Commissioner to understand that it is meeting the needs of the local area. But I think the leader may want to add some more to that.
I've actually alerted to the MP and made sure that he is aware that we need to have a focus from the ICB on Bracknell Forest residents. We had a conversation last week regarding that, and I note that one of your recommendations is relates to that as well, doesn't it? So we can certainly take that forward too.
Both MPs?
That was going to be my point. We've got 2 MPs in Bracknell Forest.
I will be speaking with the second MP. I think we've got a meeting booked in for next week.
Yeah, just a technicality. It was just one MP. The second MP couldn't make it that day at short notice, and so we've rescheduled for, I think it is next week.
It's a good answer, that one. Roy?
Yeah, the Thames Valley is a huge geographic area with a huge population. I'm just thinking aloud here about coterminous boundaries, where they align. We've got our local hospital close to us, which is outside Thames Valley. How does that going to work? I'm just really confused about all of this.
So there has been commitment from the Thames Valley ICB that the Frimley Healthcare Trust will stay within the footprint.
Excellent, thank you. Thank you, Councillor Webb. Now, just moving on to demand for services. Jodie, do you want to choose 2 of the questions that we've provided?
Yeah, so in Q4, the rate for children protection plans was 69.8 against a forecast of 47. Can you? So it's so obviously it's in the red. Can you explain the reason for this and what measures are being taken to reduce it, please?
So it will be linked to that overspend. So it will be children with complex needs that we have needed to provide additional support to. So I wouldn't be able to go into specific details because I wouldn't wish to identify any of the scenarios. But that is very closely linked again to our approach around supporting the whole family.
Okay, and my second question, which I also gave to Councillor Wright, is what statutory pressures are going to be? Sorry, apologies, I've already asked that one. What will the differences between the safety valve programme and the new SEND reform be, and what will the concerns be for the community?
So the safety valve programme was set up to support local authorities to reduce the deficit that they had on the high needs block. So this is all funding that sits separate to council funding. And we committed 23 million of our reserves to that fund to help reduce the deficit. So as part of the safety valve commitment, one of the key ways in which we can reduce the deficit is to improve sufficiency. In other words, that means school places in the borough so that children are educated in the borough and they're not going out of borough to higher cost places, and not necessarily, as alluded to in the earlier item, feeling part of their local community. The reason why I articulate that is because that's a very specific programme. We also had our usual improvement programme as well around SEND, and that was looking to equally make a series of improvements. So there were a lot of action. We had a lot of action plans to improve the service provision across the borough and to improve the number of school places. With government ceasing the safety valve programme, in essence, that means that they have committed to covering up to 90% of the deficit within our high needs block. The reason why that is important and why there is a link with the SEND reform plan is because the SEND reform plan will provide the confidence to government that we as a local authority have a strong plan in place to ensure that every child has access to the right education and support that they need within the borough. and that will encompass all the activity that we are we've already mapped out through our action plan, through following our Ofsted inspection, and through all the action plan associated with the safety valve programme. When we submit that, and once that plan is accepted, we then also have a release of the reserve that we allocated to the high needs block deficit. So that's why the SEND reform plan is our top priority at the moment, because we know, one, it will articulate how we can support every child in the borough, and our plan to do that, how we can support the implementation of the changes that government want to see, and how we can roll out the expert at hands provision. It will also articulate how we will be continuing to increase the number of appropriate places, either within our schools or within or special schools, and you've had an update as to where we are with those numbers. So for whilst it is a huge undertaking, and it is a massive strain on existing officers who are either providing services or looking at delivering the improvement programme that we have for SEND already. Actually, their focus is on getting the SEND reform plan right, so that we can have the reserves released and we can crack on and deliver the services that we need to for our children. So I'm confident there will be numerous benefits in the not too distant future, and by that I mean this coming academic year, and in the longer term with better provision of school places.
Thank you. I do have one more question.
On the same subject?
Yes. Again, I also asked this of Councillor Wright, but delays in digital systems and monitoring and procurement improvements seem to be a constraint. What are the specific systematic risks relating to delays in the digital system improvement or replacement, please?
So, from my perspective, we provide very good quality digital services, but where the organisation has struggled is to understand the value of its data and the importance of improving and being continuously improving the data infrastructure that we have. So then when you look to make improvements in your software, when you're looking to improve access to your data, you find that you have to make improvements to your data before you can make improvements to the software. So I think that's a bit of a legacy issue, but that's something that we're looking to address going forward. I'm sure it will come up at some point during this conversation, but we have just awarded a contract with a transformation partner who will be looking across the organisation around how we manage our demand and where our costs lie. One of the key things, one of the first asks is, please can we have access to your data and really understand how the organisation is working. That will also then help them inform where we need to invest first, so that we can be evidence-led and data-led in our decision making.
Jenny,
Thank you.
Is it specifically around demand for services? If you hold that question, that's the last category. Absolutely.
Thank you. On a slightly more wide scale, from both the Cabinet's perspective and also the CMT's perspective, how are you balancing, given all the pressures on the borough, the balance between simply dealing with operational matters on a day-to-day basis and actually thinking about more strategic issues for the longer term. And well, the longer term, that's debatable. But I'm quite keen to understand whether you're spending all your time having to deal with day-to-day matters, or whether you actually have capacity and scope and the ability to spend time thinking not just 6 months ahead or 12 months ahead to the next financial year, but perhaps 2 or 3 years ahead, because I think you've got to balance the two, because making operational decisions now will impact what happens in the future. And I just want to understand from both of you, from the Cabinet and the CMT, how you balance those two issues.
We had this conversation today about, you know, the long-term financial stability of the borough and what options are open to us for the long term, whatever that may look like, whether that's options with regards to council tax, to the amount that we charge for services, whatever it looks like. But that's certainly something that as cabinet members is at the forefront of our mind, you know, whereas operationally officers will be dealing with the day-to-day, with literal fires. We have the ability to think longer term, and then we have that discussion with officers.
So building on that, we obviously have our Vision 2050. Mm-hmm. We have the Stronger Together community strategy, which is up to 2036, 39. I forgot 36. I've got the number the wrong way around. So there has been some longer term thinking, but what we've done is tethered that to the 3-year settlement that we have been given, and that clarity on the financial envelope that we have enables us to then plan for those longer term decisions. The transformation partner that we've brought in will be looking over that 3-year period as well. So there are a number of tools and mechanisms that enable us to make sure that we are taking a longer term view. Certainly having a medium term plan, financial plan that is clearly over a 3-year period enables us to start thinking about what do you need to invest in now in an investor save proposal, for example, and stimulate a pipeline of those proposals so that they can feed in and start feeling the benefit of in years 2, 3 and beyond. Yes, it is demanding for a small authority when there are sudden spikes in demand. And we do find that some of our senior leaders in the organisation have to focus on specific issues. We've just mentioned the recent incident at Jennett's Park, and that has taken up a number of senior officers' time in making sure that we respond and recover appropriately to that. And so some things then do pause, and they have to get picked up at some point, but we manage that from a safe and legal perspective.
Okay, thank you. We're going to move on to cyber resilience. Recognising there are two questions. I'll start with the relatively straightforward one. Many cyber incidents actually have a very large human aspect to it. And so the question I have is, are you content that the cyber training that we have in place and the completion rates meets that requirement? And the second question is, recognising the landscape we're currently in with local government reorganisation, and that any change going forward will have significant impact on our IT estate, are we continuing to make the right investment in our cyber resilience?
So in terms of training, we run annual GDPR training, and we always look to hit a 90% completion rate, if not above. I think we've hit 90%, is the latest stats that I have. And we have mandatory training on information security for all those individuals that join the organisation. So in terms of training and the completeness of that training, I have assurance that we are investing in our staff. Incidents happen. We have an ability through the information governance team. We log any incidences. Colleagues know how to log any incidences if there have been any data breaches, and we respond accordingly. We receive a report each quarter on what those look like, and respond accordingly as to whether we need additional checks and challenges or if it's further training for an individual. They're quite... I have not received any significant red flags in the last quarter. In terms of GDPR issues.
Sorry, on that one, Sue, rather than GDPR, which I understand around information governance, and that's the control of that, it's more the ability to recognise, for instance, phishing.
Oh, yes. Yeah, and that's actually included in that training, because that is phishing, because it is part of the, what do you need to look out for to prevent anyone then gaining access to your data. Yeah. The second point around local government reorganisation, Bracknell Forest is not going through any kind of local government reorganisation, but we're very mindful that our neighbours, such as Surrey, Oxfordshire and Hampshire, are. We know and recognise that depending particularly in the Oxfordshire proposals, that might include West Berkshire, and if that does include West Berkshire through the Ridgeway proposal, that might impact then on our shared services and then might have a knock-on impact on our software. At the moment, it's really difficult to know and understand because they've had no announcement. So it is a risk, and it's one that we are aware of, but it's not one that we have a clear response to yet, because we will have to mobilise that response once we understand government's preferred configuration in Oxfordshire.
Any cyber questions? Normally the chair of Environment and Communities would ask this question, so I will do that one. This is around the delivery of the climate change plan. So a whole host of climate related issues are included, and environmental. The first one is what is causing the delay to issuing the local climate bond? What measures have been taken to accelerate its issuance, and when will this happen?
So the climate change bond was delayed back in, I think it was October, when Council requested that the risks were articulated in the Treasury Management Strategy. So that then delayed our ability to issue the bond. So we brought the Treasury Management Strategy back to Council during the budget meeting and was approved. And we will be looking to initiate the bond. We still have to go through an assurance process with the organisation that manages the bond in effect, to ensure that we meet the financial credentials. Once we've completed that, we will then be able to launch the bond. Obviously, we also need to have assurance that we have the right level of projects, and the climate change team and property are working on those.
Thank you. Second question in this area is around the deteriorating recycling contamination problem. We've gone from 18.7 versus 14.3% target. What measures are being taken to reduce that problem?
Yeah, I can take this one. It's really disappointing when we go below our target, especially for things like recycling, because we do so much education. There's so many posts that go out, and recently we put a QR code on the back of everybody's council tax bill, and I can't remember what it said, but it's something like, we could save $1 million. We could save $1 million every year, and then you did the QR code, and it would take you through to how to recycle correctly. So that's one of the actions that we've taken. Just a note on contamination itself. There was nothing specific in the bins. It was more that there was food, for example, in the blue bin. Containers with food have been put in, and that of course spoils everything else that's in there. Or it's items that have somehow got stuck together, probably with some kind of food stuff. Or it's carrier bags. So the carrier bag will be counted as a contamination, but then once you get to the recycling centre, that bag is opened, so everything that is recyclable within that carrier bag can of course be recycled. The crews are checking the bins before emptying, and there's a fine line, because crews will, if they see something in there that shouldn't be in there and it's on the top, they will take it out. And they will still remove the bin and do the necessary. But there's a very fine line between sort of going through it and taking bits and pieces out that you can, or actually leaving the bin in situ and putting a note on it for the resident. The waste, anybody that is a repeat offender, as it were, and continues to recycle incorrectly, then the waste team will write to them. And it's all about communication, and especially with flats where there is more of a transient community, you need to keep on top of that communication. It's no good doing it once. You need to be doing it, not 6 monthly, but yearly at least, to make sure that everybody is aware. I spoke about the council tax envelopes, and then also we are engaging with managing agents and housing associations as well, because they have a duty to ensure that their tenants are recycling correctly.
Okay, thank you. We're going to move on to recruitment and retention. This question really covers the retention number, so it's probably more you, Sue, I think. There's been a slight decline of staff retention, 89.2 to 87.9. Are you concerned at that's relatively small change? Is it part of a pattern that you've seen, and do you have concern? And the other question is around, there's been a slight increase in total staff sickness, 2.1 days compared with 2 in the previous one, just so it is a change. And I'm just wondering whether you are seeing any patterns, and if so, what steps are you mitigating this?
Thank you. So I think for both of those stats, we're still below the national average. So in terms of overall concern, no. I think given the level of change that we have just discussed around local government reorganisation within ICBs and other public organisations, I'm quite pleased with those figures at the moment, because there could be more movement in the future. And I think we continue to be an attractive place to come and work. So they are small percentage changes. We haven't looked at those and thought we have a significant problem, but we have seen the benefits of as I've mentioned before, the retention and recruitment programme. And we have seen the benefits of the work that we've done on reducing our reliance on agency. So I think a slight reduction, and the sickness figures, again, a slight uptick, but no specific trends that we've looked at that we're concerned around. There are pockets of teams where we might see an increase in churn. We've mentioned the SEND services. We have been very proud to have a stable team over the last 18 months, where sort of for 5 to 6 years, actually, we had the majority of the team were agency and could leave at any time. But we've got a much more stable team now. But we are starting to see colleagues move on to other opportunities. And part of that is where other authorities are offering more for the same role. And that puts us in a very difficult position because we obviously have finite resources. So there are small pockets where we have specific issues, but that's not related in significant trends in the data that you have.
Rob, you have a question?
Yeah. Do you see the local government reorganisation taking place in Surrey, Hampshire and Oxfordshire as potentially an opportunity for us to improve our recruitment rates?
I see my things as an opportunity, Councillor McLean. So yes, I think there is. It will be dependent. In Oxfordshire, it's very interesting because they have a proposal that is just one authority that is aligned with the county boundary, and then the other two proposals include West Berkshire. So when you're looking at skills and experience, if you're bringing, you'll have, if the Ridgeway authority is formed, you'll have unitary officers, district council officers and county officers, all with mixed abilities and skills. So yes, I think there is an opportunity in the whole landscape to give some really very experienced individuals further opportunities. And we will certainly be making sure that we position ourselves that if anyone is interested in working with a high performing unitary council, then they'll look for Bracknell Forest.
So these are the SEND questions. Jenny, would you like to do yours first now?
The expert hand, will they be employed directly by Bracknell Forest, or will there be a central register and they're then either sent to us or they choose to come to us?
Thank you for that question. I'm afraid I can't answer that question because it's very early days. It's not something that we've really referenced in the CPOR for last quarter because it's part of the SEN reform plans. But I can take that question away and get an answer to you.
Thank you.
So this risk is actually savings delivered by the safety valve, and actually it would feel that this is the corporate risk register probably needs to update it, recognising that that's the case. I can see that being a recommendation that's explored. There are some questions that Councillor Wright has already answered. The closure of the actual safety valve programme itself, are there any concerns that you actually have on that side of the equation rather than the reforms coming in that are that present any risks to the for instance the financial stability or the delivery of SEND services at this point?
No specific concerns about the closure of the safety valve programme. However, I think you are absolutely right. The risk profile needs to be reviewed across the whole of the SEND function because the risk now sits in different places. So with the Department for Education confirming that they'll cover the deficit, the risk now sits in part with them. And that is why they now need the SEND reform plans because they need the assurance that we've got a plan to improve and to deliver the places that are needed within the borough. So you're absolutely right. That it's my view that risk needs to be reviewed. And as I think I've said earlier, that all the actions that we were going to deliver under the safety valve programme will be picked up anyway within the SEN reform.
Any more on SEND? I think we've given SEND a thorough overview and scrutiny this evening. With that in mind, last chance for any further questions for the leader and the chief executive. In that case, thank you very much for attending, and I hope the first AI-supported scrutiny of key leaders in Bracknell Forest has been a success. We shall have a review, but actually it feels very thorough. All 37 questions in detail that we had. So thank you very much. Let's move on to agenda item 8, which is the Thames Valley ICB reviews. Sorry, would you have anything you'd like to add? Oh, in fact, I haven't done it. I've missed a big chunk out.
I was just, thank you, just the recommendations.
I've just a huge, great chunk I've missed out. Thank you very much for bringing it to attention. So, there's a bit missing there, Sharon. So, what we'd like to do is move into debate and move into debate. So the first recommendation that obviously springs to mind is the one that was articulated right at the very end, which was reviewing the risk profile, and that makes an awful lot of sense. Is there anything else that anyone would like to add, having listened to the what's been said? Jodie?
Well, feel free to phrase this however you prefer, because obviously I'm not known for articulating these. But as the changes to send services are going to come fast, and I imagine there'll be a lot of changes, can we receive regular updates as to how the budget is being monitored in this respect, and how the deficit is being mitigated?
We should get that data, and I'll probably just check. That position should come out quarterly in the CPOR, correct? Chief Executive, is that the case, Sue?
So we will be submitting quarterly reports to the DFE. I think it's worth being explicit as to what you would like to see, because I'm not sure exactly yet, because we haven't had sight, as to what data is going to be captured through that quarterly reporting, and it might not meet what you need in your expectations. So I think there probably will be something, but if you wanted to articulate what you wanted, then we would be able to do something behind the scenes to manipulate the data so that you got sight of the detail of what you needed.
Thank you.
I think what that means for us is actually being really clear of what that is, and there's some thinking that needs to be done around that. So that's something for us as a commission to work through. Rob, did you have your hand up? No. Jodie?
Perhaps looking at the number of placements that have been procured as we go along might help, and what of those placements have been filled, possibly.
There'll be quite a few figures, so in order to let's do an off-camera meeting to just work out what they are as a commission. I think you're probably right. So that the action for us there is to work out what we'd like to hear. Any other questions? So there's two things that come out from this. The first one is a recommendation to review the risks, the strategic risks, and the risk profile for the cabinet in terms of the changes that have taken place around the send domain. And then the other action is that we will do a review on some thinking about what we would like to have reported in terms of metrics, KPIs regarding the new send reforms. You're okay with those two, Sharon?
So the first one is that the strategic risk register and risk profile be reviewed and updated to reflect the change in the send domain.
Just call it the send domain.
The second is for the Commission to review on the key metrics that the Commission require report on in the send review, the send reform.
Do I have? I propose those recommendations. Any seconders? Donna. Thank you very much. Votes for? That's unanimous. At last, I bring that to the end. Thank you very much. Who would have thought this bit of paper was so important? You can't AI that. No, you're right. Right, anyway, so moving on. Thank you very much, Chief Executive. Thank you very much, Leader. Thames Valley ICB is the next one. Sorry, John, you wouldn't have been copied in to this slide pack. This is following the Commission met informally on the 20th of May to discuss the scope, focus and approach. I've refined the slides with the scope on it, and I've sent it out again. Please do have a look to see if you'd like to add anything. Fair enough. We would look to get those signed off at the next Commission meeting, so that we can get on with the review around the change of the ICB. So it's really an information point of this issue. In terms of work programme updates, agenda item 9. Let's start with environment and communities. Have we got any slides, or is it just what's... Oh, yeah. I'm off to the Cabinet on the 23rd of June. Okay, right. Health and care plan, Jerry? You don't have to stand up?
No, it's okay. I'm going to, just so you can hear me, because I'm sitting sideways. I haven't got a slide. I haven't really got much to update from last time, but I do have some news in that I believe that the staff are going to be given a walkthrough through the new Skimpit Hill site tomorrow. So we are eagerly awaiting the opening. In terms of adult social care, we still haven't sorted the scopes. There's no news there. And I did visit, I did do the J-Hos, but that's something we don't discuss here. But I'm happy to update anybody on the meeting that I went to on Tuesday. So it's up to you if you want to ask me any questions.
Any specific things you wanted to share?
It's quite boring, really, because the meeting was a non-event in that we still don't have a site. And one of the things that I was a little bit alarmed about was the fact that the new hospital programme has been extended now to 2035, and we did actually voice our concerns about that. So it's gone from 2033 to 35. So, but we are told that we're going to get a news of the site in the next couple of weeks. So we just wait with bated breath.
Okay, thank you. Jodie?
Well, our engagement and communications review was presented to Cabinet on the 19th of May, and recommendations were accepted. No further comments, Chair.
Thank you. Just an update from me. In light of the new Commission activities, namely the Thames Valley ICB, which I spoke about at agenda item 8, I've asked officers to bring forward a revised work programme to the next Commission meeting, setting out how that work will be scheduled and supported. And so we can get that done as quick and as practical as possible. Thank you for everyone attending. I appreciate the effort and all the work that was put into